Getting tested for COVID-19 can be simple and free, but it doesn't always work out that way. Some find themselves paying up to $400 to see if they've been exposed. Why would they do that? Well, some essential workers need results fast so they can get back to work, and county testing sites can take time to get results. But it's federal law that insurance companies pay the full price for COVID tests, so why are people being charged so much? Our investigative partners at iNewsSource have been looking into this for months now. Joining me is investigative reporter Mary Plummer to break this all down for us. Mary, thanks as always for joining us.
Thank you, Carlo.
Mary, how did your team get onto this story, and who is charging these exorbitant prices for tests?
Well, we reached out to readers and audience members and asked them to share their experiences, and what we found was quite alarming. Several people that our reporter, Jill Castellano, interviewed reported to her that they'd paid more than $100 for COVID-19 tests, even though there are a lot of free testing sites. And all of this is causing real problems for workers who have employers who require testing. We spoke with Carmen Lucci, who works at a restaurant in Del Mar. He had to pay to get tested quickly so he could return to work. And for him, the cost was equivalent to about 3 days of pay. Here's how he described it.
How insulin costs so much money, but it's very cheap to produce. And, it's almost the same thing. And they're just taking advantage of people like me who have to show up to work to get their tips or whatever. And paying out that $200.
That is so rough. And so if someone does need a test quickly, can't they just bill their insurance after they pay out of pocket?
Yes, they can, but seeking reimbursement can be confusing. It can be overwhelming. And we actually found another problem. We commissioned a survey from a company called Clear Health Costs. They are an industry leader in healthcare pricing research. They found that among 50 local testing providers here in San Diego County, almost half did not accept insurance in some or all cases. So, essentially placing the burden to pay on the person needing testing. And some of these tests are quite expensive. We found rapid tests around San Diego that cost up to $400.
So they're gouging people essentially. And isn't there accountability for that kind of thing? Doesn't the federal government regulate this type of thing exactly?
The prices are not regulated. Insurance companies are required to pay the full cost of testing in most cases when there's a valid medical reason for needing them. But under the Federal CARES Act, which we all remember, there are no rules on how much testing can cost at these clinics, and they're not required to send bills to insurance companies if they're out of network. So this puts the entire responsibility right back on the patient. And for essential workers and other people who are busy with families or juggling work responsibilities, navigating all of this, as you can imagine, can be a headache and a real challenge.
Mary, we're out of time, but just quickly, are there some good ways to find a good testing site?
Start with government sites. The county is operating testing sites that are free regardless of whether or not you have insurance. They are certainly a trusted source, but will take a few days to get you your results. CVS and Walgreens are other good options.
All right, Mary Plummer with iNewsSource.org. Another great investigation, and thank you again for your time. We'll see you next week.
Thanks, Carlo.